All right. Hello, everybody, and thank you for joining. I'm Mike Marvin with Healthgrades, and I'm happy to be hosting this conversation with Tom Kruse of Virginia Mason Franciscan Health, where we'll be focusing on Tom's sports partnerships in the Seattle healthcare market and the impact they've had. Tom, if we could start for everyone who may not be familiar, I've had the privilege of knowing you for a few years, but if you could start by just kind of giving a little bit of your background and time and career in healthcare, that would be a good start.
Sure. Thanks for having me, and I hope this proves valuable for everyone showing up today. Thanks for taking your time. So I've worked my whole career since the mid '90s in the strategy realm, and so in the way at least that I came into the field and the way I've worked my career is strategy is we're not fortunate enough to be in a clinical field, but we support those who do frontline care, and we support really broad teams and our job is to help change the organization, change the way the organization shows up in the community, change the way we add value in what we do as health systems. And the way to do that is to constantly be asking ourselves, how can we show up better? How can we better connect with our internal and external audiences, those kinds of things, as well as how can we drive new business? How can we help build trust? How can we help folks think of us before they think of our competitors for all the right reasons that we all believe in our health systems, that where we add value and why we provide great care. And so being able to do that, I feel very lucky across almost 30 years of doing this that I've been able to work for some great health systems in the Midwest a couple times. I've been on the East Coast. This is my third stint on the West Coast. And so I've really had experience and exposure from everything from local small health systems with just a couple hospitals to now being part of, being one of the biggest divisions of the national enterprise of CommonSpirit Health, which is obviously one of the largest health systems in the country. So it's been very exciting to have such a diverse background and experience with different kinds of systems, and I've had actually a lot of years of experience, good experience with Healthgrades as they've evolved too as a product and help bringing value to the industry. So I'm really grateful for them to host this time today.
Yeah, well, we're very grateful for your time. For the audience sake, as I started asking Tom some questions and he started sharing his insights, please feel free to post your questions into the chat as we go. We want to make this as collaborative or interactive as possible and avoid sort of a set webinar structure here. Promise you won't ruin Tom or my's flow, but so as you think of things, please feel free to put them in the chat and we'll ask them where appropriate in midstream. So Tom, let's go ahead and dive in on the content here, but I want to ask, not necessarily sports focused, because we'll get into that in much more detail, but I want to start by asking your opinion on what are some of the important things to think about from a strategy perspective when you look to get involved in the community in a larger partnership perspective, as you identify entities you want. It's more than your logo, I guess, things that you want to partner with, and it doesn't necessarily have to be sports related, but any advice you could give the group?
Yeah, I think first and foremost, I think you have to be honest with yourself, and there's a lot of things that whether your culture calls them shiny objects or distractions or something else, you have to make sure that the things you're contemplating doing actually add value. I think those of us who are in overhead areas have to be very conscious of, I use a formula I always have with my team ever since a colleague of mine 20 years ago introduced me to the notion that, we work in a very low margin business that's based on a lot of volume. And so every $1 million we spend, we really need to bring multiple millions of dollars of new business to the organization as a result of that, or the organization may have been better off without that spend. And so I think we have to think about that when we're looking at things in the community to say, does this truly advance the mission and the vision and the purpose of my organization, and help us actually deliver more care, better care to our customers, or better access, or something that's value added at the core level of what we do, versus is this an activity that will be amusing or entertaining or novel or something that just is fun or exciting. And I think really questioning whether or not each of these things is truly accretive for the time and the money spent. And I think that's probably a good core tenet to start from. And then secondarily is doing this going to build trust? Every time as everyone, most of the people on this call are connected to brand at some level. And as you think about the value of your brand and the perception of your brand, every time you bring in an external party that you don't control or that you don't know what they're going to do next, you're taking a risk with your brand. And so you really have to think about, is this organization aligned with the values in a way that I can predict with a fair degree of certainty that if I publicly, build this association with our organization, that I'm not taking a risk of eroding the brand and therefore the trust that my patients and my communities have in me by virtue of partnering with this external facing company. So,
And as it relates specifically to the sports relationships that you have in that market, where did the idea come from to start attaching yourself to those professional brands that are in market? We are all familiar with them. I'm in Metro Detroit, and obviously I've seen a ton of Seahawks and Mariners games. But talk a little bit about where the idea came from, and then perhaps any roadblocks or barriers to entry you may have encountered once the idea took shape.
Yeah, so I think the whole idea of really connecting these things intentionally was really birthed in a member of our team in a previous health system that actually now has spun off into create a company called Playbook for Health that we continue to work with. But they were in-house at the time working with us in a big health system and in around building brand and about looking at our relationships with sports in particular. And I think what we really did is instead of we wanted to use that premise that at its core sports are emotional, right? Because if they weren't, its logic would tell you that there wouldn't be such a high density of fans that happen to live by the team that where they're fans of, right? Because as we know, if it was purely performance, there would be a great deal of diversity of fans in any given market and not the high concentration. So there's an emotional connection at the local level that says, I feel part of something. I'm part of this community, and this is a representation of my community. And that we started to call the transfer of trust. And the reason part of that is most of us at some level, we're a big corporation in our community, right? And by virtue of looking at trust surveys of consumers, basically the larger, more distant a company seems to be, the less trust seems to be ascribed to that, right? Our doctors, our nurses have a high degree of trust, but us as a health system is not a high degree of trust. Insurance companies is even worse. But when it comes to sports teams, data shows us that over 80% of fans trust the sponsorships more than they trust other advertising. And so the day and age, the way that the media markets have changed, the day and age of us going out there and saying, we're great, come to us because we said so, are kind of over, right? That way of getting customers to actually change their patterns is kind of gone by the wayside. And so we're really into that, again, what we've called that coin, that transfer of trust that says, using that trust in the sports teams and getting the sports teams to understand how we add value and then use that in their words to communicate to their fan base that they trust us. If you build it right, it doesn't look like a partnership at all. It comes off to the fan as the team selected us because these teams have millions and millions of resources and they can pick anybody they want because they're these great teams. So therefore, if they pick so-and-so, then they really must be the best. And that's the end point you want to get to in the mind of the consumer, is to that point where there is no doubt because the team has said you're great that you are. and that actually yields, and we'll talk a little bit more later about kind of where the ROI starts to come in, but that's where you actually start to build some traction with converting people to your brand or solidifying them with your brand.
So we have two questions. One will come from the audience here, but one is a follow-up to that trust and aligning yourself. It would seem to me a challenge is initially getting to that trusted partner perspective versus big money advertiser. As you mentioned, how did you balance that early on, or what thought went behind that to moving from advertiser to trusted healthcare partner?
I think the biggest one comes in the way that you activate. I've talked to organizations in my markets that were not me, that said, I'm in this because Dr. So-and-so is important to me, and Dr. So-and-so wants to be the team doctor, and so therefore that's all I really care about. And so they buy some advertising, and that's good enough for them. That serves their purpose. For most of us, I think, that really want to build on it as a brand enhancement and a growth tool, you got to work past that. You got to think about, what does activation mean? And oftentimes what that won't mean is a bigger sign in the stadium where, in the case of MLS, where you're essentially advertising to the same 30 to 50,000 people, every week all year long, and you're not necessarily reaching new people when you're in stadium, and it's not necessarily about getting a sign on something, although that's visible to some people. It's about translating that into actual patient speak. It's about getting it in front of your employees. It's about using it to build philanthropic energy and causes. It's about getting earned media. It's about getting your providers to get interviewed by the media partners of the team and such like that, so that again, it's showing up to the consumer as wow, these guys really are, they must be the best because of how the team is showing up. And then I think it's oftentimes thought of, but not oftentimes thought of rigorously enough, is how to activate that internal audience, how to turn this into a team building tool, how to turn this into a reward and recognition tool, in a way that is accessible to everyone. And that usually means a hard conversation with people like me in the C-suite to say, hey, this isn't about you going to a game. This is about us, driving maximum value for all of our employees to feel engaged in this. It's little things like, if you're partnered with an MLB team, there's 81 home games a year. Everybody announces their opening lineup. It takes next to nothing to get a team to say, hey, can one of our employees say, welcome to the game today, here's the Mariners starting lineup, and record 81 of those for them to use in a game. And they're like, yeah, sure, whatever. I mean, there's a lot of things that if you work with the right people who know the space, you can actually get some ideas that bring in hundreds, if not thousands, of employees and clinicians into the feeling part of this, and with very, very little spend.
So this is an appropriate time to ask this question from the audience. Very complimentary of the content so far, but they asked, how much of your partnerships convey into what they would call community good, both externally in the community and then internally, as you started to touch on, throughout the organization?
Community good is a challenging definition. Every system, every community, contemplates what is in that formula a little bit differently. Maybe I'll just, if you don't mind, I'm going to just pull up a few slides. There's a deck here that'll be available to everybody afterwards. I'm going to pick a few things from it just because some things are visually displayed in a way that's better than I can probably describe them. Assuming that's coming through okay.
Yep, I can see it on my end.
So when we look at our system strategy, as I said, we're looking at a lot of different value streams. one of them, again, it's making news. It's getting cancer survivors on the field for the NFL game that the news media is going to then pick up. It's getting the doctor interviewed for the things that our earned media teams are already doing every day. It's doing vaccine partnerships with your insurance partners that most of the days don't act like friends, but if you align around something like vaccines, that you'd be surprised you can find some, real community good. We just did a thing with the King County, which is where Seattle is, does a free clinic every year at one of the stadiums. That's owned by one of our partners. So we participate in that along with some of our other colleagues, but we participate at a bigger level. And they see 3,000 people in a weekend, that otherwise would either be in our emergency room or wouldn't end up getting the care that they need at all. And those kind of things are, again, there's a level of activity there, but there's virtually, lower end of cost. Like I said, the staff engagement is real. We know that there's a lot of stress in the industry. We know that people struggle to build teamwork in an environment where there's activity going on all the time, codes and things like that going on. Getting people away for a little bit or getting the teams to come to them can be a real value add that builds direct value for the system. Getting service lines out there in a way that people listen to them. You'd be surprised when you do research on community recall of your service lines, they will remember a tweet from your sports team about a service line, and they'll ignore the $1 million you just spent on the media by advertising for yourself. They never even saw that, or it's the place where they went to get more popcorn during the show instead of watching your ad. And so some of these vehicles, you can communicate more value again through that third party validation than you can by advocating for yourself. Many of these teams are big companies. They have to do things that kind of speak to the community at large. It's really not that hard to bolt on to what they're doing. Sorry, you want to say something, Mike?
No, this is a great question that came in. And it touches on just what you said about service lines and things. How do you determine internally which areas of the organization receive attention in terms of promotion or alignment? Now, being a sports fan, I know that each league sort of has causes that based on where they're at in their sports calendar, or, I know MLB does a lot, especially in the month of May around Mother's Day, players all using pink bats, those types of things. How do you determine internally who receives attention or promotion in these sponsorships?
Yeah, that's tricky. So everybody on this call, I'm sure, has dealt with the provider who just says, well, I'm a great doctor. If you just put my head on a billboard, it'll drive more volume, right? It's a quintessential example. And all those people mean well, but the reality is we all balance a degree of, we know which service lines drive our biggest contribution margins. We know where we have capacity for growth that we can accommodate. Those become obvious solutions. Because of the way these things play out and what's involved in production, you typically have to have some lead time. So it can't be something that, like, the left big toe clinic has room this week, but next week they're full for 3 months. You got to deal with things that have a little more longitudinal. At the same time, when you got those itches, you got to scratch, right? We all have those doctors who are just like, all right, I got to do something, right? And I don't want to spend the money, but the reality is they're important to us and I need to do something. A little photo op that you're going to then drop in a back of a program of a baseball day game is a really easy way to create validation. Showing one flash up on a jumbotron during a game, during a little ad spot that you got, and get someone to take a picture of it. I know people that still, their mothers send them pictures with this stuff framed, and they still have it in their office 10 years later. I mean, this stuff goes a long ways if you use the one-off sometimes to cover the things you need to cover. And if you do partnerships through different venues, you end up with a lot of different places where you can get those little featurettes. You can do, you can do deep dives in things like, we had a player come to us recently from the Seahawks that wanted to do something around stroke awareness because of his personal family story. We've had over 20 different clinicians now been able to get in and be part of kind of riding the wave with this comic book that we created along with Bobby Wagner and that's now got him out talking to kids. And so we're able to put doctors with the kids, with the kids, talking about stroke awareness and the signs of stroke and those kind of things. So there's a lot of different ways I think that you can use those little vignettes to get in the onesie twosies and not have to necessarily create a campaign around everything. Because at the end of the day, if your system's like our system, the top 4 service lines drive 70% of my contribution margin of my whole system. Where those go, the whole system goes. And so if I'm spending limited dollars, I gotta spend it in those areas predominantly, because that's where my yield is, that's going to fund everything else. And so then you have your collection. So the trick is adding up your resources and then deciding what you can use for those vignettes and what you really need to drive that consistent message built around.
Here's an interesting question that came from, I think that that slide that mentioned Boeing is, aside from global sports marketing, does Virginia Mason directly market to employers in the service area? Do you partner with large employers?
We do. We don't. We have about 400,000 lives under management in our market that we take some kind of value-based risk around. Some of those are direct to employer. Most are through MSSP and other tools like that, MA plans, those kinds of things. We also develop, and this is where your strategy team and your marketing team should really be very closely knit together, building partnerships with teams like One Medical and such that are working with those direct to employer, but are also but are also driving new volume that may or may not want to come through your front door. So you're diversifying your front door, but meanwhile, all the halls lead to the same health system. And so if you can use those employers and kind of that illusion of free choice to help consumers pick their own front door, knowing that all the doors eventually come together, you can drive a lot more growth that way than you can by trying to drive a hard sell, at least in my opinion, around some of those things. And companies like Boeing's a perfect example, largest private employer in our market, has 3 major plants and has long been a kind of a bellwether employer that has driven a really hard bargain. The other piece to think about is you can use the brand, the cachet that comes with being associated with some of these sports partnerships and having some of these bigger partnerships in the community. You can use those as kind of reverse leverage inside of some of these large employers through the commercial products that they're offering their employees. If you build up your value enough, people will shop inside of their large employers' insurance options to find an option that includes you. And I think that's where you want to get to, because then when you have enough of those, then you can talk about value. You can talk about bundles. You can talk about all kinds of things that are going to get to more of a value proposition conversation than just trying to drive clicks through a turnstile. Because at the end of the day, that's a game of diminishing returns, right? You get one and you got one. You're really trying to build total lifetime value, and you're trying to build new patients to the system that then stay in your system. The best way to do that is to add value and to be indispensable. And again, that's where your brand at the end of the day is what will keep people. And if they feel like, well, all the big names pick them, and those people could do anything they want, They have the money for anything they want, so therefore they must be the best. That's where you're trying to get to, and then they'll choose you no matter what.
Second there to take a drink, Tom, before the next audience question. This one relates more towards the competitive nature of the Seattle healthcare market, the greater Seattle healthcare market. How does Virginia Mason differentiate themselves in order to become the sports team sponsor of choice? What was that process like to win out? And I'll ask, because I'm intrigued, is there a vetting of Virginia Mason on the Seahawks side or the Mariners side to allowing your brand to attach to their brand? What was that process like?
Yeah, it's more of the former than the latter. But again, you're trying to create that illusion in the mind of the customer that's more the latter than the former. You want them to believe that the team went through this agonizing process of only selecting the best and they picked you. And you want to reinforce that every chance you got. The reality is most of these teams, they don't even like exclusivity unless they can get the right price point for it, or they have such good trust built. Now, the case of the Seahawks had a 20-year relationship with Virginia Mason Medical Center when it was a standalone organization. They built that at a time when the Seahawks were new, and frankly, they were pretty terrible. And so they couldn't drive a lot of dollars from a sponsorship standpoint. And so they had a very modest relationship that didn't have a lot of escalators in it. And when the time came for the renewal, the relationship, we had added value on so many levels. We had helped them we'd helped introduce them to new category partners that they could have a conversation. We helped add value to their business in addition to showing how they could add value to ours. We also were very careful to make sure we didn't create a burden. You don't want to be that person that's calling, asking for, hey, so and so, I need 10 tickets on the field this weekend. You don't want to be the person that's that pain in the rear that they say, maybe we should look around. You want to be careful to govern that side of it. The other piece, and I'm going to share again here just 1 second, is you need to do some survey work in your own market, and you need to decide what the incremental value is for each additional sports team. And when you look at people in every market's different, and when you look at your market and say, what percent of my market is a fan of this? And if I'm talking to them through this partnership, and I got to spend another, pick a number, pick $1 million to add the next team. In this case, if I add the Mariners as a partner, Seattle, the Seahawks, we happen to be exclusive partners. Kraken, we happen to be exclusive partners. Sounders, we're no longer partners with, which we could talk about why. The Mariners were 1 of 5, and we're just fine being 1 of 5 in the MLB space for good reasons. But we got to know that when we're adding the Mariners, we're only adding 5% of the population that aren't fans of the Seahawks also, because at some point, talking to the same people in 3 different ways isn't worth more money. You're better off spending that money on activation, which is why, again, the Playbook for Health team took a long time tool that Healthgrades has really perfected in many ways, which is taking the consumer segmentation model and applying it to sports and saying, so we know that this is the socio-demographic profile of a Seahawks fan, which is the largest fan base. So we know that they're the easiest to reach, but the hardest to distinguish ourselves amongst. So where do we find them? What venue, what media channels are they consuming this content from? Are they in podcasts after the game? Are they listening to it on the radio? Are they only watching it on TV? Do they only go to the games live? You got to know where your customer is and which part of that segment you want to reach before you decide the what. And then you got to decide, okay, if I add more money to sponsorships, am I really adding an incremental new set of patients to the point where it's worth that money to do that. And then especially if you cross-tab that back down again to, well, if I'm using the same media channels for 3 different teams, I can get a better scale play on my purchase as well. Then you could potentially activate more teams with more segments, using the same, using a single media buy where you get a better value per impression, than if you go from there. And like I said with the Sounders, the MLS game here in Seattle is actually really, sorry, my system's running really slow. Just gonna exit out here and go down. The soccer thing in the Northwest is a really big deal. And I think the other piece you got to bake into all of this. So the Sounders came to us and said, we want to go exclusive instead of non-exclusive, which is what we were. But we think it's worth X. X was about 6 times what we were willing to pay. And so it was a really easy decision for us to say, we knew from our research that keeping the Sounders did not add many incremental parts of the community. We knew that those fans were being touched by other sports. And the segment that we were missing was largely the customer base that was the least of our target audience from an ideal customer segment standpoint. They were the younger, more healthy, less healthcare decisions being made population for us. And so we knew that letting this team go, even though we were kind of losing sole possession of large sports teams in the market, as being the predominant player, we were going to share that, in this case with Providence, which operates Swedish here. We knew that would turn out okay. As it turns out, this is the part you got to be careful of, that whether it's, I'm not being political, but because Bernie Sanders has been pretty articulate about this category for us in the healthcare space, especially not for profit, about the money we spend in some of these sports partnerships. You got to be careful about the visibility of this stuff, because if you aren't careful, you could end up, Providence got terrorized for months because there was a press release that declared how much they spent on this partnership with the soccer team. And the people that pitched it were the people that sold the partnership. It was great news for them, right? They sold a big deal. For a not-for-profit health system that had just riffed a bunch of people, it landed, pretty dead. And so they have, to this day, they have people in the stands with banners that mock their logo. They have people outside the stadium selling iron-ons over their logo on the jerseys. They've really started a bad experience with a number of the fans. And with, again, like we said earlier, with soccer, with fans in the stadium is kind of your biggest audience, right? It's a very loyal base, but it's kind of the same base. And so if you lose the base, where's the value? And I think that's what part you got to keep in mind is there's going to come a time in all of our careers, because I don't think it's very far away, where there's going to be public scrutiny of whether or not-for-profit health systems that are receiving charitable tax relief and these other community benefits, whether we're adding enough community benefit to justify, big spends in these spaces, and whether or not we're going to be driven away from this space. At that point, if you can't talk about the actual value that you're adding and how you're changing people's lives, how you're educating people to, changing health status, those kinds of things with these partnerships, you're going to have a tough time defending this internally and externally.
Tom, we have had a slew of audience questions come in, so can we kind of, I guess, start to take on some of those here and use our time? Want to save a little bit of the ROI stuff towards the end, but this I'm sure you'll probably touch on this a little bit in this question is, how difficult is it in these economic times to get CEO or board of director approval to engage in sponsorships like this, or to continue to sponsor partnerships like this in your market?
I would suggest that the answer to that is it's either really easy or it's really hard. And I'm not trying to be flip about it. If you are not using actual market research to talk about, this is what we know about our customers, our target audience, our service lines, how they view us, how they view the teams. If you aren't using actual consumer research to backstop your conclusions, you're just going to sound like a fan who wants free swag or tickets, right? And so you have to be able to articulate, here are the assets. This translates into, 2,500 employees and their loved ones and their team members, experiencing social team building time together every single year. This is 25 public opportunities where the team is going to vouch for us at large. And you have to be able to articulate, and this is why we care. And then I think you also have to look at it and say, and here are some of the other things we spend money on, and here's the impressions those drive. Again, we'll touch on it when we get to the ROI, but for all the years I've been doing this, it wasn't until recently that I don't even remember where it came from. It wasn't my idea, but I loved it. It was someone on our team had a really smart idea about asking a question the right way that enabled us to get to more direct attribution. And I would say that's however you do it, you want to get as close to direct attribution as you can. Because most of these teams, they're designed, the sales team is designed to sell you the partnership, sponsorship, advertising, whatever it looks like for you. You have to know what to ask for, because there's also a pile of assets that, like just knowing that, a partnership with Coke, Coke gives charitable funds away every year. So you'd be foolish if you didn't ask them to make a commitment to your foundation, and they really won't even pause to say, well, yeah, sure. We're giving the money away anyway. We might as well give it to you. And so you gotta work with people who actually know what to ask who for, so you're not a pain and you're not asking for too much that makes you sound inappropriate, but you're not leaving anything on the table either. There's a lot of, I would say in most cases, there's a third to maybe half as many assets as come with any deal that are kind of free for the asking if you know what to ask for. And some of those are baked in this deck, you can look at them, but you should figure out how to look for those little validations that are going to help you throughout the year. And this is where your marketing, PR, communications team, community relations and sales, and all those different functions that are likely under most of the people on this call. This is where your on the street knowledge of your team really comes to play. When you say, if you could have 5 things from this NFL team, what would it be? And you'll be surprised. Tickets won't be number one. It'll be, well, if I could get them to retweet this, that would be awesome. I mean, and so there's a lot of things like that you can get in. And when you start showing those kind of values versus a billboard versus a TV ad with the production cost, and you start putting all that stuff together and you show, and this is how many downstream visits it actually drives, this stuff adds up pretty fast to a pretty good value. And that's where the conversation becomes very easy, because you're able to articulate it. The second piece of it is, then don't get lazy. Go track it every year and ask people, did you see it? What did you think of it? I do focus groups, put a couple bucks into the back end that says, did it actually add value? If it didn't, you can now sit down with the teams, which are very data driven in most cases, and you can say, we laid out these 11 things that we were going to do each year as part of this partnership. These 5 are falling flat with the customer. Can we talk about trading those up? you'll be shocked. In most cases, they'll be like, sure, what else? What would you like to try instead? There's other options on the table, and the teams want you to be successful, but they don't. Your job is activation, right? Signing the deal is 5% and 95% is activating it. Their job, 95% is selling it, 5% is activating it. So if you give them an easy thing to say yes to, they'll say yes, but you got to ask. They're not going to like come to you every month with, well, here's 15 new ideas we came up with for you. There's 45 other sponsors that they're working with, and they're selling to 44 of them. So once you're sold, you got to advocate for yourself with them, again, with the assumption that they want to do the right thing and they want to help you, and they will, if you ask them the right question, if you ask for something that's reasonable. And keep in mind, you're in healthcare. You're not in a space where Coke and T-Mobile and they're not asking for the same things you are. So nobody's asking for a player visit to meat and cheese factory, right? So they're
To that end, a question came in around social media and the value of attaching your brand to tweets that the organization makes or the team. How collaborative are they? To retweet things you're doing, say from the Seahawks or the Mariners social accounts, and then B, has your data shown that consumers notice that and it moves the needle in terms of overall trust with your brand?
Yeah, the last part of your question is honestly the hardest part. Is does awareness translate through to advocacy and ultimately lead to trust and then lead to advocacy in addition to patronage? And so it's as you progress through the stages of better alignment with the customer, where does this add the most value? And obviously a lot of the things like tweets and stuff, it raises awareness. But again, knowing that 81% of my fan base trusts the thing the team says, I know I'm starting off better than if I ran my own ad. So I'm kind of moving right into the trust space right off the bat. Then the trick is turning that into something actionable. I would say in most cases, teams are not well situated to make emotional, compelling, action-oriented tweets and things like that. You're going to write them for them. And if you got a good team, over time, they'll learn to trust you. They'll always change it, but they'll change it less, because if you did a lot of the heavy lifting, and again, as long as you're not being selfish or greedy, they want the easy button. They want to make you happy. And if it's not a big thing, they got everybody saying, hey, can you use your 4.5 million followers to my advantage? They got a lot of that, right? And they won't have 4.5 million followers if they bury everyone in ads. So you're going to have to probably put in your agreements on the front end how many times a year you're going to do it. And you may even have to be specific about what kind of categories you're going to do it in. And if do you expect that to come from the coach? Do you expect that to come from a player? Is the team in general good enough? You're going to have to be a little specific about what you want, and then you're going to have to do the legwork for them. Do people remember it? It's like anything else in social media land in particular. 1 in 5 you strike gold, and the most obscure, weird storyline that you retweet some player, help some woman who couldn't get out of her car, and then somebody gets it on video. And those things catch fire, right? And so you make gold with those things. That's why the Bobby Wagner stuff with the Fast 54 was such a gold mine for us, because it was him, it was his mother, it was his family, came from poor upbringings. Now he has is obviously very successful financially and can do anything he wants. And so it's his story. We're just helping facilitate it, and we're helping give it a vehicle, and we're helping give it something that he can hold up and talk about and do something with. We don't actually have to do it. And that you want to get as many of those kind of things as you can. But again, you got to do the work. You got to spend the couple $100,000 to build things like a comic book and get it printed. And I'm actually talking Friday night at Comic-Con, which I knew existed, but I I never actually envisioned myself going to it. And I can only imagine how excited the people will be to come listen to a guy with a suit jacket on at a comic book convention. But it's a new venue where, again, people are going, what's Virginia Mason Franciscan Health doing here, and why are they talking about this star athlete and what he's doing? This is curious to me. My guess is those who listen will remember, and that's what you're going for, right? The stickiness of that one message.
Tom, regarding the athlete exposure, when you have a real life story like that, are they eager to share, or are there complications in terms of appearance fees and agents getting involved? How do you navigate that in terms of a celebrity relationship? Local celebrity, certainly.
But players are tricky, right? They get traded. I remember a colleague of mine years ago. I was actually in a meeting with her on the East Coast when one of her football players was famously seen assaulting his girlfriend in an elevator. She couldn't run out of the conference fast enough to get. I mean, she couldn't get distance from this guy, right? And so now that was one person who obviously made a horrible choice. But it's always the risk when you tie yourself to a brand of a person, personal preference. And again, I have relationships with active players individually. We get some players offered through the teams. We also engage some separately. And I would say, like in the case of the Mariners in particular, they cycle their team a lot. And so we chose to invest in Dan Wilson, who's a Hall of Fame catcher with the Mariners, who lives local and is now part of the sportscasting team and the coaching staff. He's going to be here for a while. He's on the street, recognizable. He's also, 50 years old, and he's got a family, and he's in that category of stuff that turns into health, business. And so in my case, he's a better spokesperson for us than any active player would be, because he's going to be there next year. He's going to be there the year after. I can build a longitudinal relationship with Dan, and he has done amazing for us. And he's so recognizable that there's no active player that we're going to keep long enough that's going to help. At the same time, when we first signed on with the Sounders, we had a player built into our contract. That player, because of the political, viewpoints that are prevalent in our community, that player felt uncomfortable being aligned and being a spokesperson for a Catholic health system. He was willing to do it, and I said no. If he's nervous about it at all, we want someone who's proud of our brand. And so you got to search for that person who, and sure enough, we found a Central American, immigrant player who his whole family, the history of his family was Catholic, and he went to church 3 times a week. I mean, he became an amazing spokesperson for us. And then he just so happened to turn into one of the best players on the team, which that's where the real value added. But you gotta be really careful when it comes to individuals, because individuals, they flitter in and out, and then they do things that are unpredictable. You got to remember, most of these men and women are youngish people who make all the same bad choices that we all did and our kids do, right? And so you got to be careful with your brand tied to those, and keep your ability to separate as fast as you can. We use a moral turpitude clause in all of our contracts that basically leaves a pretty broad interpretation of our own that says, if you do or say or anything, today's volatile age, one bad tweet and you can't get away fast enough because of a word choice someone made, or a bad photo they posted. You need the ability to separate from any individual as fast as you can.
Fantastic. As we close here, the audience has been awesome with your questions. We really appreciate it. Tom, I want to be careful in these last couple of questions not to ask the chef to give away their secret recipes or ingredients. So let's talk what you're comfortable sharing in terms of ROI and how you measure success, how you continue to talk about these successes you're having organizationally, to leadership, to continue to grow these partnerships or reinvest. What are you measuring? How are you measuring the who, what's, and whys, if you will, that you're comfortable sharing?
Yeah, there's a slide in this deck, and I'm willing to share some details about it. Let me put it up here. And let me tell you, first off, what this is based on. So the smart question that I referenced before in our community survey work was, we finally thought to add the question, did you choose our health system just because of the sports partnership? And I don't know why we never thought of that before, but that after we added it, we thought, I wonder what that's going to yield. Sure enough, we got back a very solid 2% of the population said, yeah, we chose you just because of the sports partnership. And there will be many, we all know, right? Expenses are orphans, and new revenue is a big party, right? So everybody wants to take credit for new volume. And half the people are saying, well, we would have got it anyway, and all the rest of this stuff. You now have a question that has an N attached to it, that you have a confidence interval to generalize to your population that says, no, these are people who just picked us because of this. You can also, if you're making the case, if you're not in this space yet, you're not defending it, you're trying to get into it, do the survey anonymously and ask about your competitors who are in these partnerships, and ask the customer if they pick them because of it. You can do this, you can validate the numbers. It doesn't have to be about you. You can validate the numbers about others, and then you can see your market's propensity to pick someone because of the association. It will vary in every market. If you're, I happen to grow up a Dallas Cowboys fan just because I'm from Iowa, and there aren't any, so you got to pick one. And so it's so Dallas Cowboy fans in my generation were all the rage because of who they were then. If you're a suffering Cowboys fan like I am, it's been a long time since we've been kind of the team of choice, or even I like to still say America's team, but it doesn't hold up as much. But there's places where the team brand is right up there with a religion, right? In terms of, if you're in the South, right, you can get an SEC or a NASCAR partnership like my colleague in Florida does, who she says is just gold for her. Up here, that would have no value whatsoever, because University of Washington's got the UW. And so it ends up being, you got to know what you're picking in your market, and you got to know where that value is. And then you got to get that attribution proven. Don't speculate. If you have to connect more than 2 dots to your ROI, you're not going to make it. CFO, somebody's going to take it apart, and probably with good reason, because you're speculating. You need to get as close to direct attribution as you can, and then make your case for contribution margin by patient. And you got to know what data you have in your system that's bulletproof. If I were you, I would start with your CFO first before you tell them what you want to do, and say, what are the downstream profitability metrics that you believe are airtight, and help me understand what those are. Is it average contribution margin per admission? Is it lifetime value of a patient for a new primary care? I mean, decide what your value elements are, and then back into that, so that you're not later trying to convince someone of 8 different variables to get to the conclusion, because once you've told them there's a conclusion, you're going to run into a lot of walls. Again, just because that, there's an easy willingness to, for a lot of folks to ascribe something good to many causes. And so you want to single yours out, and it doesn't have to. We're about a $4.5 billion system, so 51 million isn't the be all end all when it comes to contribution margin, because by the time you get that down to actual net income dollars that it starts to get a lot smaller, but it's still more than pays for all the partnerships, all the activation, and all of the dollars that we spend helping employees and stuff like that take advantage of it, and the things that we do to, get the teams out there with us. But you can see some of the numbers here. You feel free to, again, you'll get this deck, so you can feel free to scrutinize these. And again, I know it's just the company that I've chosen to work with, but Playbook for Health has backed into all of these over the years, and their roots are inside of health systems. They're not like, they also have the roots in hardcore sports management, like NFL back office kind of stuff. And so if you find a company that has those strengths, they can bring that value. And again, I would say the other piece is and if you're on this call, you probably are already a Healthgrades customer. And so using the tools around segmentation and the things that are already established and baked into the rest of your ROI conversations, most of this it's not too much of a stretch building on top of those things. If you don't have any of that infrastructure in place, I would say take a year and build your infrastructure underneath it first before you try to jump to ROI, and then go from there. The other piece I would say is start small. You don't starting with a multi-million-dollar, sports partnership when you are new to it, is you don't have to bite off something that big. Start with something more manageable. Even if you're in if you're in Texas, high school sports, right? High school football is probably a massive book of business. And so you got to know your local market, and you got to know where those hotspots are. And I think most people are familiar with, little plays like Little League, right? If you sponsor the league, it costs you X. If you sponsor the Pee Wee team, they print a T-shirt for those kids, and those kids wear that T-shirt 6 out of 7 days a week, all season long, right? Into every store they go into and everywhere else. So there's ways to really capitalize on some of the smaller plays first, and then start to get a sense for what where the value is before you go into the big dollar stuff.
Outstanding. Tom, we used pretty much the whole hour. Want to thank you for allowing me to be a part of this conversation and moderate, but for your time and being so generous with it. And also thank everyone who attended and submitted questions. Tom has committed to sharing parts or most of that, those visual aids that he showed today in terms of slides, as well as if there's any lingering questions that weren't answered here, we can shoot him an email and he'll respond back. So thank you very much, Tom, for being a part of this. I'm sure everyone that attended found it very valuable.
Happy to be here. Thanks for the invitation, and I hope I added a little bit of value for the folks that were able to spend the time with us. So thank you.
Yeah. Thank you very much. Everybody have a great rest of your day. Tom, you as well. Thank you so much.
Thank you.